Good evening, everyone, and thanks for joining me today to talk about BPH and Utolift. My name is Dr. Philippe Nabbout. I'm a urologist with Wichita Urology, and we will be talking this evening about BPH, which is a very common disease, and one of the treatments for it, which is Utolift. If you have any questions, please use the chat option at the bottom of your screen to send in your questions, and I'll try to answer as much questions as I can at the end of the presentation. So this is our agenda for today. First of all, we're going to talk about the prostate. What is the prostate? What does it do? And then what is benign enlargement of the prostate? How is it diagnosed? What are the treatment options? And then finally, we will go over the Utolift system treatment. So what is the prostate? The prostate is actually a walnut-sized gland that is situated at the base of the male bladder. It surrounds the urethra, as you can see in this picture. It goes around it from all sides, and it produces fluid that transports sperm during the ejaculation. So it's really important for men during for the fertility potential of men. There are basically two phases for prostate growth. The first one, the prostate grows to a normal size in teenage years, and after that, it will continue to grow later in life. And as you can see, as we get older, us men, all of us, our prostate will enlarge. There are several conditions that can affect the prostate, and they can range from infection, which is called prostatitis, prostate cancer, which is a very common cancer amongst men, and it's actually the most common cancer in men in the United States. And finally, enlarged prostate, which is also very common. And you know, each of these conditions is independent of the others. So you can have one, you can have two, you can have all three together also. This is another picture, so another slide showing also that, you know, BPH is very common, and as we get older, it becomes very common in men. And by age 80, 90% of men really will have an enlarged prostate. So how do we, what is exactly benign prostatic hyperplasia, or what's known as enlarged prostate? So benign prostatic hyperplasia is the clinical term for an enlarged prostate. It's a non-cancerous enlargement of the prostate gland. So this is very important. When men hear enlarged prostate, they immediately think cancer. It has nothing to do with cancer. It's a completely different disease, really. And it doesn't mean that you are going to have cancer. It doesn't mean that you are at risk of having cancer. There are two different things, completely independent. And really the best way that we have to differentiate between prostate cancer and benign enlargement of the prostate is by doing a prostate biopsy. PSA alone, so PSA is a blood test that your primary care will do to screen for prostate cancer. PSA by itself is not sufficient to differentiate between benign enlargement and cancer, and biopsy is what usually is indicated. So again, this is the picture that we looked at the beginning of the presentation, which shows the normal prostate that encircles the urethra, which is right there, that tube, and this is the bladder. And as the prostate grows or gets bigger, as you can see here, it begins to squeeze and begins to put pressure on this urethra. So the passage becomes narrow, which causes problems with urination and makes it harder for the bladder to empty. And this is what causes the symptoms. So what happens with time, again, this is on the left side, this is a normal prostate, wide open urethra. The bladder is able to empty without any problems through this passage. But then as the prostate gets bigger, this passage becomes very narrow. And you can see that the bladder has to squeeze extra hard to empty at this point. That's why the muscle of the bladder becomes very thick. And then when we look inside the bladder, you will typically see those, what we call trabeculations, which are those ridges inside the bladder. These are signs that the bladder is squeezing extra hard to empty. And if this is left untreated, with time, what's going to happen is that the bladder is going to fail completely. And the only way to empty the bladder is going to be with a catheter. Again, this is a series of pictures showing the same thing. The bottom pictures shows what when we do a cystoscopy. Cystoscopy is basically a scope that I do in the office with a camera that goes inside the urethra to look inside at the prostate. So this is what I look at. And you can see on the left side, this is the opening in the bladder. It looks open. Here, you can see the enlargement. It's beginning to happen. This passage is becoming narrow, and here it becomes very narrow. So what are the symptoms of BPH? And multiple symptoms really. The most common symptoms are frequent urination, going to the bathroom every hour, every 2 hours, every 30 minutes. Sometimes also the sudden urge to urinate. My patients will tell me, I feel the urge to go, I can barely make it to the bathroom. And I sometimes leak on myself. Difficult or painful urination, and this is because, remember, the bladder has to squeeze extra hard to empty that urine. So that could be painful and difficult at the same time. And then you will notice that the stream is very weak or slow. You will feel that you are unable to empty your bladder all the way. And then during urination, some men also complain of the stream stopping and going. And this will affect your quality of life. If you have to go to the bathroom every 20 minutes or every 30 minutes, you probably won't be able to travel. You can't do things that you like. Another thing that's very important also is waking up at night to go and pee. This is also a very common symptom of BPH. And that was, this will disrupt your sleep, not only your sleep, but also your wife, your girlfriend, or your partner's sleep. So how do we diagnose BPH? And really the most important factor in the diagnosis is the medical history. So it's the questions that we ask the patients, and then the answers that they give us. And then this is the main diagnosis, really. Physical exam is important. We typically do a rectal exam to try to assess the size of the prostate, look for any nodules or any irregularities that are suspicious for cancer. We also do an ultrasound in the clinic to see how well the patient is emptying his bladder, how much urine is he leaving behind after he empties. Another important factor in the diagnosis is a score, and we're going to go over it here in a bit. It's called the International Prostate Symptom Score. It's basically a questionnaire that will ask you questions, and based on the answers, you will come up with a score. And this score will allow me to determine how severe your symptoms are and how bothersome they are to you. Other studies, and these we don't do all the time. It's basically studies that I would personally do if I'm not sure about the diagnosis, or if we are planning on a surgical intervention and we want to make sure that we are picking the right surgery for you, then I would do one of these tests, which could be an ultrasound with or without a biopsy to rule out prostate cancer, and the cystoscopy, which is that scope that we talked about, where I go inside the urethra to look in and to see the shape of the prostate on the inside. So this is that score that I was telling you about, and basically the questions, it goes over the questions. It will ask you how often do you have frequency, intermittency, urgency, weak stream, how often do you strain to urinate, how many times do you wake up at night, how many times do you feel like you haven't emptied your bladder all the way. And then based on the answers, it will give us a score. And, you know, the score can go from 0 to 35. And you can see here, if you're in 0 to 7, it means your symptoms are mild. You probably don't need anything to be done. Above 8 is when you begin having bothersome symptoms that would require treatment. And, you know, between 20 and 35, severe symptoms. And I think the most important question really is the last one, meaning regardless of the score, how bothersome are these symptoms for you if you have to live like this for the rest of your life? And, you know, a lot of the decision making really is based on the answer to this question. So what are the treatment options for BPH? And, you know, the treatment options can really range from medical to surgical, as we're going to see. So this is a, you know, nice slide that shows you the progression of the treatment options, and we go from the least invasive to the most invasive. You know, least invasive obviously would be watchful waiting, which means doing nothing. And then the most invasive would be laser surgery or robotic surgery or open surgery. And then you have everything in between. So you start with less invasive. After that, you have the medications and the herbal remedies, anything over the counter, or all the commercials that you see on TV. And then you have the Utolift system, which is between medication and between the less invasive surgeries, like, you know, thermotherapies, which are treatments where we heat the prostate or we vaporize the prostate, and then, you know, laser surgery or surgery like TURP, or the scraping the prostate on the inside, removing tissue to make the channel wider. So watchful waiting, obviously, is the least invasive of everything. Advantage is, you know, it doesn't cost you any money. There's no side effects. There's no surgery. However, you know, you can try to decrease. What can happen is, as we saw in one of the previous slides, even if you're not bothered by the symptoms, if you let these symptoms go for a long time, and if your bladder becomes weaker and weaker, what can happen is that the symptoms are going to become more severe, but also the bladder might fail completely, which would lead you to needing a catheter or, you know, to empty your bladder, and you would be relying on a bag to empty your bladder for the rest of your life. So the next step would be medication, and there are several medications on the market for, you know, benign enlargement of the prostate, and you can see some of them up here. But the advantage of the medication is that you avoid surgery, and then a lot of them really work well and they can give good results. The disadvantages is that once you take it, and if it works, you probably have to take it for the rest of your life. So it's a medication that you're going to take for the rest of your life, because as soon as you stop it, the symptoms will return. A lot of the medications also have some significant side effects, and mainly it's going to be sexual side effects. The two most common side effects are ejaculation problem, and then lower sex drive, problems with erections, problems with libido. And finally, with time, as you remember, that your prostate will only increase in size, and as it grows and increases in size, the medications will become less effective and might at some point stop working. Herbal remedies like saw palmetto or all the prostate health commercials that you see on TV, you have to remember there is no science behind those, meaning there is no, in clinical trials, when they compared patients that got these remedies versus patients that took a sugar pill or placebo, there was no difference in outcomes. And then you know, these herbal remedies, even though they sometimes don't have a lot of side effects, they can lead to bladder stones, they can lead to problems with your kidneys, and then they really won't stop the natural progression of the disease, and they would be only just delaying the real treatment. So I typically don't recommend herbal remedies to my patients. Which brings us to the Utolift system. So the Utolift, what's the advantage of it? I think the main advantage is that it can be done in the office. Minimal anesthesia, fast recovery. You go home the same day. You avoid going to the hospital. There is 0% sexual dysfunction with Utolift, which is really one of the major advantages of the Utolift. It doesn't affect your erections. It doesn't affect your ejaculation. The recovery time is faster compared to more traditional surgeries. And a lot of patients don't require a catheter afterwards, which is, something that's very bothersome to patients. And we have enough data at this point to show that it has durable results over the years. Disadvantages is that, you are awake during the procedure, so you will have some discomfort. And then during the week or two that, after the procedure, you will experience some blood in your urine, frequency, urgency. But most of those symptoms will resolve within 2 to 4 weeks, which is much less compared to the more traditional surgeries that we used to do on the prostate. So thermotherapies, these are procedures that we do in the office. So this is, also an advantage of these. However, the main disadvantage of these therapies, which is those therapies involve heating the prostate, vaporizing the prostate with heat, is that they require a catheter for several days, and it takes 4 to 6 weeks, sometimes even longer, to experience any relief. And then there is a potential for sexual dysfunction. So it's not 0% sexual dysfunction. Finally, surgery, whether it's laser, whether it's scraping the prostate to remove tissue. So the advantage of surgery is that it's going to provide you with a really wide opening because we're removing prostate tissue. So it's durable. It has a low retreatment rate because you are removing tissue. And it does give you a good flow and good symptom relief. The disadvantage is that it requires anesthesia, it requires hospital, sometimes overnight stay. I would say most of the time you have to stay overnight to make sure you're not bleeding. You are going to require a catheter after surgery, usually 2 to 3 days, sometimes longer. And then the recovery time is longer, up to 6 weeks. And then surgery, the potential of complication is higher compared to the least invasive procedures that we do in the office. And this would be bleeding, infection, problems with retrograde ejaculation or losing ejaculation. Most of the patients would lose ejaculation after a traditional prostate surgery. And then there is a lower risk of incontinence, strictures, and erectile dysfunction. So let's talk about the Utolift system. So this is a 4 pictures that shows you what I do. Basically, the first picture shows you the enlarged prostate with the narrow channel. And then I go in with the scope, and this scope has the Utolift delivery device on it. And I put that in the urethra. Then I start by deploying 2 implants close to the bladder to start opening this channel. And typically I will put 2 more closer to the urethra just to make the channel wider. And the way those implants work, they will basically lift and hold the tissue and push it apart to create a channel. So this is one of the main advantages of the system, is that you're not resecting tissue, you're not heating tissue, you're not ablating tissue, you're just pushing the tissue away, which is why it's much less invasive and has much less side effects compared to the others. I would say the majority of patients will get 4 implants. However, some will need more. The most I've done is 7 or 8, I believe. But I would say the majority is 4. And this is how the implant looks. It's basically a suture in the middle. Then you have this stainless steel piece that's on the urethra side, and this will be on the prostate side. And you can see how small it is compared to a dime here. I actually have an implant here with me. I don't know if you can see it on my camera, but it's really very, very small. And this is a picture of how things look, you know, and this is a picture from the cystoscopy. It's that scope that I told you about that I do in the office. And this is the scope at the beginning of the procedure. You can see how the prostate is blocking the urethra completely. You can barely see the opening, the lumen. And then after the procedure, after we put the Urolift implants, you see how the bladder neck or the urethra is wide open. And this is a patient that's going to pee very well after this procedure. I can tell because the opening is wide. So what to expect, you know, I always tell my patients things will maybe get worse before they get better. And the initial week or two, even if we have this wide opening, keep in mind, your prostate is going to be a bit inflamed, the bladder is going to be irritated from the procedure. So the first 2 weeks, you will have pain, burning, blood in the urine on and off, pelvic pain, frequency, urgency, and sometimes a lot of urgency, really. However, most of these symptoms are mild, and they typically will get better within 2 to 4 weeks after the procedure. And the nice thing about this is that the symptoms might continue to improve up to 3 months after the procedure. So you will continue to note improvement. And we have studies now that have, you know, one of the biggest questions that the patients ask me, you know, this is a new technology. How do you know that it's going to last? Well, we have studies now that have shown that this is durable for at least 5 years, which is comparable to the other surgeries like the scraping or the more classic surgeries of the prostate. This is a slide from that looks at the outcomes of my patients. So this is patients that I have done. The blue one is my patients actually, and the yellow one is the is from the study called LIFT study, which is the study that gave the Urolift approval to be used in patients. And you can see that on my patients, this is the score that I was telling you about, which is the IPSS, or we call it also the AUA symptom score. And you know, most of the patients started with a symptom score of 24, which is severe symptoms. And you can see by, you know, by 2 to 3 weeks, they dropped to 18. 1 month, they were about 10. 3 months, they stabilized. And you can see that 1 year later, they still around 10. So we have a drop from 24.8 to 10. So more than 50% improvement in symptoms. And this compares to the study that gave the Urolift the approval. So we have very good outcomes, and I've had very good results with this procedure, really. With regards to the insurance, you know, it is currently approved by Medicare and by most commercial insurances. You know, we have a very good billing department that will work with you, and we're not going to do, really, I don't do the procedure until the patient is aware of all the billing aspects, until we make sure that the insurance is going to approve it. So we don't want any surprises. And if you want more information, you can always go to the urolift.com and you know, look under insurance coverage. So you know, I hope this talk helped today. I am available to talk to you anytime. You are welcome to call and make an appointment, and you know, we'll sit together, go over things, do an exam, and then we will decide what's the best for you, whether it's the Urolift, whether it's something else. The goal is to give you a better quality of life and to help you treat this disease that's very common. So thank you for listening. And if anyone has any questions, I'm happy to answer. Just send them. Does Dr. Davis perform? Let me just open the questions here. Does Dr. Davis perform the same treatment option? Yes, he does. How long does the surgery take? So the surgery, from the time you walk into the clinic to the time you leave, I would say about 1 hour. But the actual surgery, the time that I will be in the room, is maybe 10 minutes for me. But you walk into the room, you do the questionnaire, then you sit in the room. They give you the anesthetic. We have to prepare everything, clean everything. Then I walk in, and like I said, my part is about 10 minutes. But then after that, we make sure that you're comfortable. So I would say the whole thing, from the time you walk into the clinic to the time you leave, is about 1 hour. My time is about 10 to 15 minutes. Will the procedure need to be repeated in 5 years? We don't know. It depends. This is the average. And even with classic prostate surgery, sometimes you have to do something else because the prostate will grow with time. But let's say in 5 or 6 or 7 years, you have the symptoms again, then yes, one option would be to repeat the procedure, same procedure, and put more clips, or we can do one of the classic prostate surgeries. Any risk of retrograde ejaculation? No. That's one of the main advantages of this procedure, is that it doesn't cause retrograde ejaculation, unlike medication and classic surgery. How long have you been doing this? I've been doing this for 2 years, and I've done the most in Kansas. In the office, I've done about 100 in the office now. I've done more outside the office, if you can find the numbers. And I am the only center of excellence in Kansas, as far as I know, for Urolift. How long has the Urolift been in use? I think it's been around for 8 years now, 7 to 8 years. That's a good question. How do you determine if the bladder muscle has failed? Sometimes we can just tell by looking inside and based on the history. But sometimes if we are not sure and if we think the muscle has failed, we would do a study called Urodynamics, where we study the pressure in the bladder. So basically what we do is we fill your bladder with water, then we measure the pressure in the bladder, and then we see if the bladder is squeezing or not. And if the bladder is squeezing, if there is pressure, if the pressure goes up in the bladder, it means that the bladder is still working, but the blockage is very severe. But if we fill the bladder, there is no pressure, it means that the bladder has failed and the bladder is not working. It's performed through the urethra. So the scope to do the procedure goes through the urethra. It's basically like a catheter with a camera on it. It's a we do use a lot of numbing medicine in the urethra. I also use the nitrous oxide, which is the laughing gas, the stuff that you get at your dentist, in order to so that the patients are relaxed during the procedure. And I find that nitrous oxide helps a lot. Plus, as soon as you stop breathing, you're good, you're awake, you're good to go. When I started doing those 2 years ago, I was using Valium, but now, and I can still do Valium, but now I'm using more nitrous oxide. I find that it's better for the patients, in my opinion. Is infection very common after the procedure? It's not very common, but it's one of the complications. We do give you a antibiotic to prevent the infection. And sometimes if I go in and I feel like the urine looks very cloudy, I might give you a short course of antibiotics. But infection is one of the complications. I would say the rate of infection, though, is low. It's less than 10%. And an infection is common with any surgery that you do on the prostate, even any procedure that you do carries a risk of infection, even a simple scope, diagnostic scope. Other things that are common after the procedure would be blood in the urine, frequency, urgency, burning. And this is because, we went through the urethra is inflamed, so this is normal. looking for, yes, there are always other treatment options. Enlarged prostate is so common that a lot of companies are interested in it, and we always have new technologies for enlarged prostate. Uh, but at this point in time, I feel like Utolift is really one of the best minimally invasive procedures that we've had. I mean, we've had a lot of options in the past. We've had microwave of the prostate even, but that didn't work at all. Uh, there are some systems where they vaporize the prostate with water, with heat, freezing the prostate, but not all of them worked. I think the main cause for any procedure, so the question is, what are the main causes of the Urolift lasting only 5 years? And again, the message is that this is a new technology. There are studies that show durability for 5 years, but we still have studies ongoing. So in 5 years, they might say, well, it can last 10 years or 8 years or 7 years. So we don't know. But we know that at least it's going to last 5 years. The cause why it's only 5, like any procedure for the prostate, even if you do surgery, the prostate will grow again. It's part of aging. It's going to grow. So I think the reason why it's going to last 5 years in some men, 10 years in others, 3 years in others, it depends on how fast the prostate is going to grow again and how quickly it's going to do that. How common will this process fail where the implants fall out or shift? I've never had cases where the implants fall. I don't think it's described, but the risk with the implants is sometimes when you're very close to the bladder, the implants are in the bladder, they can cause a lot of irritation. I would say it's very uncommon. Like I said, I've done over 100 of these. I've had one case only, and you can fix that. So it's not common. How common will this process fail? Like with any surgery, nothing is 100%, but this has a high success rate. And if you're a good candidate, if your prostate looks like, if the shape of the prostate looks like it's going to be a good candidate for the Urolift based, then the success rate is high, and it's about 80 to 90%. And nothing really is 100% in medicine, unfortunately. But I think this has a very good success rate. You're welcome. Yeah, I hope this helped, and like I said, this is a very common problem, and whether, even if you're not a candidate for the Urolift, there is always things that we can do to help you. Is there a prostate size limit? Yes and no. So in general, a normal size prostate is about 15 to 20 grams. But I can tell you, I've seen patients with a 100-gram prostate that have no symptoms, and I've seen patients with a 30-gram prostate that have a lot of symptoms. And it depends on how the prostate is growing. If you remember that picture, it depends on the prostate. Let's say it's growing to the outside, then if it's growing to the outside, it's not squeezing the urethra, it doesn't matter as much. But if it's growing to the inside, squeezing the urethra, then it matters. So size is important because it will allow me to determine which procedure works for you better. But size alone doesn't determine the severity of the symptoms or the type of treatment. How will I know when I need the Urolift versus the other options? And this is a discussion that you will need to have with your urologist, or and it depends. It depends what you want. It depends about the other options. It depends on the size and shape of your prostate. For me, the main question when I talk to patients is that, do you want to take medication for the rest of your life or no? Are the medications working or no? And then if he says, no, I want to try something else, I want to try surgery, then the decision of which surgery to pick will depend on that scope that I do in the office to look at the prostate on the inside and see the shape of the prostate. And based on that, I will make a decision and decide. I will tell him, I think Urolift is going to be a good option for you. I think surgery is going to be a good option for you. You know, I think we can go both ways. What do you think? And, you know, each person is different, really, and it's a combination of the symptoms and the size and shape of your prostate. Okay, well, I think this is going to be it for tonight. Okay, well, thanks a lot. Thank you for joining. And like I've said, I'm happy to answer any questions that you guys have, and happy to see you guys in the clinic. And hopefully this helped this evening. Thank you and have a good evening.